Dear colleagues, welcome to this Basic Science Award ceremony. My name is Gijs Goossens and I'm working as an associate professor at the Department of Human Biology at Maastricht University in the Netherlands. And it is my great pleasure to announce the winner of the New Investigators United Award in Basic Science 2021 on behalf of EASO's award committee. And we received several excellent applications, but of course there can only be one winner. And this year, the New Investigators Awards in Basic Science goes to Dr. Roman Vangoitsenhoven. Dr. Vangoitsenhoven studied medicine and completed a PhD in biomedical sciences at the University of Leuven in Belgium. And his main research focus is the effect of diet and bariatric surgery on glucose homeostasis, which he has investigated both in rodents and in patients. And following a postdoctoral training at the Cleveland Clinic in Ohio, he's currently working as a clinical endocrinologist and part-time assistant professor at the University Hospital Leuven, where he is involved in teaching to biomedical and medical students, research and patient care at the obesity and diabetes clinics. Dr. Vangoitsenhoven, on behalf of EASO, I would like to congratulate you with this award and invite you to present some of your work in the next 10 minutes. So please, the screen is yours.
Thank you very, very much for that kind introduction. And of course, thank you to the EASO for this award and the recognition of our work. I will start sharing my screen. And I will be very happy to share with you some of my career track. I have nothing to disclose. And of course, I will focus on two of the basic science studies that are closest to my heart. So my start as a physician researcher was during my PhD at the KU Leuven at the Lab of Clinical and Experimental Endocrinology, where my promoter was Bart van der Schuren and my co-promoter Chantal Mathieu and another co-promoter Lut Overberg. As you can see, I was trained by two physician researchers and one pure scientist. And I started working on several projects which included food toxin on beta cell models in vitro, and then I did a very interesting study on islet composition after gastric bypass in a rodent model. And then I started doing retrospective studies also about bypass patients. But the story that I want to share with you here today is one that has been published in 2018. But we wondered whether there is a difference in glucose control when there is different dietary macronutrient composition during weight loss strategies. And for that, we used black 6 mice. We gave them a 60% high-fat diet to induce obesity. And then we had two groups that were restricted to the body weight of the control mice that were on normal chow. And so the caloric restriction was either with normal chow or with the 60% high-fat diet. And despite the similar weight loss, we noted that there was more epididymal fat in the groups that just were obese, but also on the restriction on high-fat diet. And not only were there more epididymal fats, which are visceral fat and thus metabolically unhealthy fat, there are also larger adipocytes, especially when you compare the restriction on high-fat diet compared to the restriction on normal chow. As you can see in the upper right panel with the dark gray bar, it is higher than the lighter gray one. We then zoomed into the liver, where again, despite this similar weight loss, we noted that there was no normalization of triglyceride content when you do restriction for weight loss on high-fat diet, when there is a similar low amount of triglycerides in the liver of the mice that were restricted on normal chow. And then we saw actually similar or the same result when we looked to the livers under the microscope, where there was remaining NAFL, so fatty liver images in the restriction on high-fat diet, but not in the restriction on normal chow. And then we also zoomed into a few of the inflammatory markers, and there you can appreciate that the TNF-alpha mRNA levels were again normalized in the restriction on normal chow to the same level as the lean, at least, while they were not in the restriction on high-fat diet. Now, of course, I told you that our initial question was, does it matter for the glucose homeostasis? And despite similar weight loss, there was a worse glucose tolerance on high-fat diet. Again, you can appreciate, and I will get my pointer, you can appreciate that the restriction on high-fat diet does not yield the same glucose tolerance as the restriction on the normal chow. And we can confirm a similar result with the insulin sensitivity test. So after that studies in the KU Leuven labs, I went on to the Bariatric and Metabolic Institute in Cleveland Clinic, and I had mentors Ali Aminian and Philip Schauer, again physician scientists, and I worked on kidney issues in bypass in ZDF rats. I've worked on liver steatosis after bypass in patients, and then I worked on bariatric surgery in autoimmune patients, but also we worked with a rodent model, now rats, of type 1 diabetes. And we wondered whether bariatric surgery can protect against development of type 1 diabetes through protection of the beta cells. And so the rodent model was BBDP war rats that developed type 1 diabetes in about 80 to 90% of the cases, around 70 to 80 days. And we did a duodenal bypass or a sham surgery. One of the benefits, of course, of doing basic science is that you can do sham surgery and you can do invasive investigations. So as the main results of this study is that there was no protection against type 1 diabetes in the bypass animals. So the development was at a similar time point and a similar rate in both groups. And also we did not see an improvement in glucose homeostasis, as you can see here in the OGTT data. What we did see was that the bypass animals did have a lower weight and they had a lower insulin need. So they required less insulin pellets to stay alive. And they still had the increased GLP-1 secretion after a mixed meal test that we know from our type 2 or our non-diabetes patients. We also saw less hepatic stress, and we saw probably favorable altered microbiome after the bypass. And I will refer you to the paper if you want to see the details for that. This has been published in Surgical Endoscopy. And then I would like to go over a few of the current projects that I'm working on, and I will refer you to two of the posters that we submitted to this conference about the changing carbohydrate intake after a bariatric surgery, and we have an interesting poster on liraglutide for weight loss in the real world. I'm still doing basic science, and we are looking into the islet transcriptome after bariatric surgery. I'm involved in a NAFLD project with the Cleveland Clinic still, and then we are trying to focus on the food reward system during different weight loss strategies in mice and in patients. And with that, I hope I have shown you what I've worked on so far. I would like to thank the EASO again for the award and the opportunity to present our work. And I would especially thank my inspiring mentors, my helpful colleagues, my general collaborators, and of course the funding agencies. And I put my email down there so you can contact me with any question. Thank you very much.
Well, Roman, thank you for an excellent presentation. And we have time for a couple of questions, if that's okay with you. The first question is, you demonstrated that dietary composition during caloric restriction has effects on adipocyte size, liver fat, and glucose homeostasis in black 6 mice. And did you examine whether the differential change in adipocyte size following the chow and the high-fat energy-restricted diets could explain the improvement in liver fat and glucose homeostasis?
We did not investigate that correlation, I have to say. One of the things that we were after, to be honest, was to see whether there was a different adipocyte number also next to the adipocyte size. because that seems to be a very debated still issue, whether you can lose fat cells also when they are not needed anymore. But we had some difficulties in the quantifications there, and we did not see significant differences in the end. But so to answer your question specifically, we did not correlate the measures of adipocytes with the liver.
Okay. And maybe another question related to that one. Did you also examine whether there was a difference in adipose tissue inflammation between the two groups that were on the energy restricted diets?
Yeah, in the interest of time, I didn't show it, but we had also the mRNA inflammatory markers, and there were the similar differences as we saw in the liver. So there was a very clear normal level in the restricted normal chow. And then there was a bit of variation in restricted high-fat diet, but there were definitely animals that still had residual inflammation. And so that was clear in the mRNA markers. But again, it was not to that extent that we could see differences in the numbers of crown-like structures. What I take from that as a clinician is that it's of course still beneficial to lose weight, even if the diet is not perfect. And so, but still, it is important to choose the healthy diet also. So there's probably two levels, we should probably put across the message that it's important to do both, not too much, but especially also good quality.
Okay, clear answer. Thank you, Roman. And a second question relates to the study in which you investigated the metabolic effects of duodenojejunal bypass surgery in the rat model of type 1 diabetes. And do you think that the beneficial metabolic outcomes of this type of surgery reflected by the lower insulin needs in these animals are mainly driven by weight loss in the rat model you studied, or do you think there are mainly weight loss independent effects?
It's not been answered, and the question is still out there. But I think the weight loss is the most important parameter for sure. Personally, I also think that weight loss is one of the main drivers also in type 2 diabetes. Of course, we see several other changes, especially the GLP-1. That's why we looked into the type 1 model as well. But weight loss is an important driver for the diabetes improvement in type 2 diabetes. We have to not forget that. In this model, I think the OGTT was not different, not in the early time points, not in the late time points. But we saw the metabolic improvements outside the glucose parameters. And so that, again, can also be the message to the patients, because we are more and more seeing patients with type 1 diabetes and obesity. And then the question arises whether we should consider metabolic surgery for that. Of course, I have to be careful not to over-interpret the rat data, but that's of course why we do these kinds of studies. And so there are probably metabolic benefits to the surgery, but not in the pancreas, and that's probably the baseline conclusion of that study.
Yeah, would be interesting to further investigate. Okay, Roman, also for time reasons, thank you once more for your presentations, and congratulations again with the new Investigators United Basic Science Award. Well done.
Thank you very, very much.